for Better Money Boston. I'm here with David Shapiro. He's Regional Director of Wealth at Johnson Brunetti. Now, when we're thinking about healthcare in retirement, this is a big concern for people, and there are a lot of questions. We have some from our viewers today, David, so we want to answer some of these. You ready for the first one?
Sure.
Okay. First one comes in from Bruce. He says, what information do I need to know about Medicare before I turn 65?
Bruce, that's a very common question we get in the office all the time. The first component of Medicare is determining when you have to start taking it. You can file for Medicare. You're required to either 3 months prior, the month of your birth date, or 3 months after. And then how Medicare works is partly driven by, are you currently still working? Do you have a retirement plan from a previous job? Are you unemployed? There's many components that come into that decision. Make sure you have an expert helping you with that component.
Okay, next question is from Carol. Carol writes in and she says, how can I avoid RMDs and other income increasing my Medicare premiums?
Carol, it's really important when you get to that stage of life because as you're taking out those required minimum distribution, all that money is viewed as income. That income could impact everything from the Medicare premiums that we were talking about earlier to your marginal tax rates and various other aspects. Simply timing that could have a significant impact on other aspects of your life, especially when it comes to taxes.
All right, David, Brenda writes in and she says, when and why is it a good idea to consider a long-term care policy?
Well, the perfect time to consider it is probably between 50 to about 60. That's when you're young enough, typically healthy enough, where the premiums are still pretty reasonable. If you have a history of having issues, it's going to be harder to get as you get older. It also depends on your overall financial situation. Do you have enough other investments that you could use in that scenario? Could you sell a home? Sometimes long-term care costs could be expensive, but making sure overall there's a strategy on how that's going to incorporate with everything else going on with your life. But be realistic, it can be very expensive, especially in the Boston area.
David, tell us about this free book.
We have a book called Medicare 2025 Guide. And what that's going to explain, it's specific about how it's going to work during Medicare and how it could impact other parts of your personal life as well.
It's free. Get it today. Go to bettermoneyboston.com. Again, that's bettermoneyboston.com.